We are grateful to have a good working relationship with each of you on the City Council. Proud to be from Charlotte and the Charlotte region, and look forward to continuing. This is just one of many conversations that we will have. We see Dana Benton down in Raleigh regularly, and so we all know how to communicate with you and plan to do that as we start our new term coming up here later this month. So thank you so much for your time and your input, and feel free to reach out to us anytime you need us.
We will. Thank you very much to each of you. We really appreciate it. Have a great rest of your day. And Dana has all of our numbers, but I think most of you know you can call any one of us on any topic, and anything that we can do to help you, help us, we're there. But also, we want to help the state. We are not just about Charlotte. We're actually about economic development. I often tell people when Anson County has jobs, I'm going to feel like I've been a really good steward of public resources, and we got to get that done. So thank you very much, and everybody have a good afternoon. Bye, everybody.
My name is Blake Page. I'm assigned to the Public Affairs Office, and if you remember, a few weeks back, we introduced a new initiative that would strategically advance Chief Jennings' core 4 priorities of community collaboration, crime management, professional accountability, and employee wellness. This initiative is called Core Status, and it's designed to bring the community and the CMPD together to explain just how we're meeting these 4 core priorities in those individual communities. Fast forward a little bit to last week, we had the opportunity to kickstart Core Stat, where we had the opportunity to kickstart Core Stat in the Metro and Central divisions. And fortunately today we have the commanders from each of these divisions, and they're going to take a little bit of time to explain just how Core Stat will assist them in helping better police the communities that they serve. We're going to start off with someone who looks probably fairly familiar, Captain Brad Koch of the Central Division.
Hey, good morning. Thank you very much, Blake. As he mentioned, my name is Captain Brad Koch. I'm the captain over the Central Division, where I have been assigned since April of last year. And we understand as a department that there is not one size that fits all in terms of providing service and policing to our community. Now, different communities have different needs, expectations, and concerns, and we're committed to providing a customized service delivery to meet community expectations. Now, I'll refer you to Central Division, where we have several unique neighborhoods that face unique challenges and require unique strategies. One concern that we had over the past several months was an influx of larceny of bicycles. Now, bicycles is not necessarily something that you think of in terms of crime fighting strategy. However, a lot of our residents were seeing a significant increase in having their very nice, very expensive bicycles taken. We met with them, provided some community collaboration. We're able to identify the individuals and made those arrests. Now, we as a police department are not going to pretend that we have all the answers, and that is why it's important to collaborate with community members who live and work in our neighborhoods. In fact, Captain Lucas V., also was part of the inaugural core stat, and he is with our Metro Division, and he too participated the other week. And at this time, I will ask Captain V to come up and give you a little bit of an overview of what they presented. Captain V.
Thank you, Brad. I'm Lucas Veith. I'm the captain of the Metro Division, which is anchored over in the historic West End, Beatty's-Ford Road. CoreStat gives us an opportunity to communicate with the community and get specific feedback back and forth, and to decide what the actual problems that the community faces and what it is that they want our officers to address. Utilizing the core four of the crime management, professional accountability, community collaboration, and employee wellness, taking these and having that as an approach for some of the crime issues that are at hand, both what we observe from our crime numbers and what the community wishes for us to address. One of the examples is during the core stat is the community leaders and members who are participating can have that conversation back and forth, not only with the division, but with the command staff for the entire department. It's also another form of transparency where we can communicate, particularly in these times, back and forth and specifically have conversations. One of the examples that we have is the high visibility initiatives we've started and conducted in the last, specifically going back to October, over 100 different individual opportunities, including foot patrols, bike patrols, walking beats, and actual community roll calls where shift briefings and officers and supervisors are in the community with the community conducting their daily brief. This provides an opportunity for community members to discuss with us what their specific problems are and to meet the officers. Officers go around, introduce themselves, step into businesses, have conversations, so that when people call 911, that it's not the first time they have an interaction with a police officer. During this time, just since October 1st, over 100 individual targeted opportunities of high visibility, community collaboration, and crime fighting efforts were conducted just along the Beatty-Ford Road corridor. That amounted to over 350 individual officer shifts being conducted along the Beatty-Ford Road corridor. One of those examples is Operation Rabbit, which is a high visibility marked patrol car crime reduction effort with reducing motor vehicle crashes along the Beatty-Ford Road. During that time, over 415 traffic stops have been conducted. However, only 88 of those stops resulted in citations. 345 of those traffic stops and interactions with the police were cleared by warning. During this time, we've had the opportunity of collaboration with our community, and that includes Mr. Burnell Berry, a rare Charlotte native. He grew up on the west side in the University Park neighborhood off of Beatty-Ford Road. He is the founder of nonprofit One Love, and which brings CMPD and the community together, which assists families, particularly targeting needy children. Furthermore, Mr. Bob Simkowitz is a community activist in the First Ward of Uptown, and they are both here joining us today. Okay. Sorry. So Burnell Berry and Bob Simkowitz, thank you for joining us. Certainly esteemed community members. We know that you have a voice in the community and you have questions and directions and goals, and please, thank you for joining us, and we are turning it over to you. Burnell, I know you always have great ideas and great questions. Would you like to start with anything?
Yes, sir. First of all, I'd like to say good morning to everyone.
Good morning.
Thank you for having me. The first thing I'd like to do is give thanks to Chief Jennings, as well as Officer Lakia Monroe, the community coordinator, to you as well, Cap, and the Metro Division, and all of Charlotte Mecklenburg Police Department for having me here today. I believe there are some key ingredients into building better relationships in the community and the police. One Love Corporation has been doing some charitable events in North Carolina since 2014, but as of 2020, we picked up the pace since we have seen our city take a decline in our youth. In October 2020, One Love teamed up with Officer Lakia Monroe, the community coordinator with the Metro Division. And since then, we have done several community events that have involved myself, One Love, Fire Station 18, and the Charlotte Mecklenburg Police Department. Together, we have went into different communities and brought joy, trust, hope, and respect to the children in the community, as well as the parents. At this point, I would like to take a moment and give a few ideas that I believe can help build better relationships. One, relationships, making a present not only when 911 is called, and just having police more involved with the community, letting the community know that the police have a personality. Trust. Without trust, police work becomes less effective, but with trust in the community, it can help unsolved crimes and help with investigations because the people start to believe that the police want to make a difference in the community and make their community a better place to live. More involvement, working with active.
Good afternoon, everybody. Thank you for joining us today. I am Dina DiOrio, Mecklenburg County Manager. I am joined today by Gibbie Harris, our Public Health Director, and Meg Sullivan, our Medical Director. I'd also like to thank our American Sign Language interpreters today, Rich Hafner and Emily Jones. It's been a busy week in Mecklenburg County. We just finished the Board of County Commissioners' 3-day budget retreat. And although it was entirely virtual for the first time, we talked about many important topics, and we have the direction we need to begin developing the county manager's recommended budget for fiscal year 2022. And I want to thank the public and the members of the media that joined in and tuned in and listened to the retreat over the last 3 days. Last night, Health Director Gibbie Harris announced that the modified COVID-19 health directive will continue through February 28th. I want to reaffirm Mecklenburg County's support of the directive, as well as Governor Cooper's announcement that the statewide modified stay-at-home order will also stay in place. As a result, we will also continue to limit the number of county services conducted in person until the end of February. The list of those affected services is on our website at mecnc.gov. It also means that while all our parks, greenways, and nature preserves will remain open and folks can continue to enjoy all of our outdoor amenities, they will also continue to close at dusk. The changes do not affect mandated or essential services that have continued during the pandemic. We are obviously glad that the data indicates that the numbers seem to be stabilizing, but they are still extremely high. I believe that Mecklenburg County as an organization needs to continue setting an example and to follow the directive, as well as we've done since last spring, align and remain consistent with the state's pandemic response. And with that, I'll turn it over to Gibbie. Thank you. Gibbie, you're muted.
Thank you. So just a quick update on our numbers. 84,936 cumulative cases since March, 770 deaths. We are averaging around 680 laboratory confirmed infections per day. That is down from the last 14 days. Our case rate is 428.8 per 100,000. That's down. Our average of 420 individuals with laboratory confirmed infections that were hospitalized at acute care facilities is down. The average of 11.9% of individuals who were tested in Mecklenburg County who were positive for COVID-19 is down. So as the manager mentioned, our metrics are moving in the right direction. Unfortunately, they're still very high. We have 66 current outbreaks in our congregate living situations in Mecklenburg County right now. One in particular that we've gotten a number of questions about is an outbreak at the roof above men's shelter here in Mecklenburg County. As of this week, we have 87 confirmed cases. 85 of those are among residents, 2 among staff. We've been working with the shelter to utilize our isolation and quarantine hotel to move those individuals that we can to that hotel who are positive, but we're also in overflow status at the hotel at this point in time. So we continue to work with them to look at other options for housing those individuals in the community in a safe way. As the manager mentioned, the directive is being extended through the end of February. That is consistent with the governor's modified stay-at-home order as well as the secretary's directive. We have concerns about where our virus in this community may be going over the next month or two. Right now, as I've mentioned, our numbers are decreasing. They're moving down slowly, but they are moving down, and we're very hopeful that that will continue to happen. But as you know, we have one of the variants that we know is present in Mecklenburg County, and we also know of another one that's present in South Carolina, and there's very likely another one in our area as well. And unfortunately, the President's White House COVID-19 Advisory Board is concerned that cases will likely surge again as these contagious variants spread across the country. So we're watching very closely. And that's why we're re-emphasizing the need for the directive. We're re-emphasizing the need for people to stay at home unless it's absolutely necessary for them to be out and about. So a couple of things I want to emphasize about the directive. We continue to recommend utilizing full virtual options where in-person activity is not required. But we also understand and have reviewed the recent study published through the CDC that indicates with appropriate safety measures in place, schools can be a safe locations for students to learn and a safe place for our school staff to support that learning. We continue in public health and in the county to be supportive of in-classroom learning as the optimal option for our youth. Our school system has worked hard and implemented back in the fall measures to make sure that the schools are in a safe place for learning and for these children to be. The main concern at this point in time is that those safety measures are implemented with fidelity. We will continue to work with our schools as they begin to open up again and hope that we'll have success in doing that as we move into the spring. I also want to recognize the fact that we're continuing to recommend that individuals not participate in recreational activities at this point in time, especially those that put them in close contact with others. That includes indoor sports. The state continues to place indoor sports at high risk for exposure, and because of the amount of virus we have in our communities, we know that exposure continues to happen in those settings. So we are recommending that individuals enjoy outdoor activities with the individuals that they live with, that they avoid any type of recreational activity that includes others that they do not live with. And we ask that they wear their masks and socially distance when they're outside. I am very grateful to our community for helping us with the needed changes in their behavior and in the activities in our community. We need to continue to be vigilant and compliant with the prevention measures that are necessary to continue to move our community in the desired direction as we fight COVID together. With our vaccines, we are working very collaboratively with our hospital systems, and we're also developing partnerships with others in our community who will be ready to administer vaccines as they're more available. And I'm going to turn it over to Dr. Meg Sullivan to give us a recent update on where we are with our vaccines.
Thank you, Gibbie, and good afternoon, everyone. As Gibbie said, I'm just going to provide a very brief update regarding vaccines for Mecklenburg County Public Health. So again, I'd like to start with some quick numbers. As of yesterday evening, we have administered over 12,300 first doses of vaccine and over 2,300 second doses. Again, we continue to vaccinate individuals in groups 1 and groups 2 as per current North Carolina Department of Health and Human Services prioritization guidance, which again, as a reminder, group 1 is healthcare workers with in-person patient contact and long-term care staff and residents, and group 2 is individuals ages 65 and older, regardless of health status or living situation. This week, we continue to provide vaccine at our Bojangles site, our medic site, and at shelters and long-term care facility sites. We also worked with Atrium Health to offer 1,000 appointment slots at their event this weekend at the Bank of America Stadium to individuals who had tried to make an appointment with us in February, but were unable to do so. We learned last night that we will be receiving a larger number of doses next week, which will include 2,925 Pfizer doses and 600 doses of Moderna. So in addition to our vaccine clinics at Bojangles, we are planning events at some specific community sites, which includes an event next Saturday with several of our refugee and immigrant partners. We are also working hard to conduct proactive outreach to prioritize Group 1 and Group 2 eligible individuals to ensure they have access to an appointment for a vaccine. At this time, we still do not have a specific time frame for when we will move into Group 3, but we continue to engage in significant planning in collaboration with our hospitals, emergency management, and many of our community partners in preparation for this phase. And finally, I just wanted to comment today on the news that was announced this morning regarding the Johnson & Johnson vaccine. So data from the phase 3 clinical trial was released of a single-dose vaccine that is approximately overall data 66% effective at preventing moderate to severe COVID infection. And when looking just at severe disease, effectiveness goes up to 85%. Of note, the trial took place in 3 locations, which was the United States, Latin America, and South Africa. The effectiveness that they saw with the trial data was 72%, 66%, and 57% respectively. The data that was just released will now undergo extensive scientific review by the FDA to determine if emergency use authorization will be granted. And while this data does not match the effectiveness data seen by Moderna and Pfizer, the ability to protect against severe disease, hospitalization, and death, the single-dose regimen, the much less stringent storage and handling requirements, and the potential to significantly increase vaccine supply in our communities are all very promising developments, and we will be monitoring the careful review process very closely. And then just to end, although a lot of what I said today is very optimistic, we know vaccine supply continues to be limited, and that while we remain committed to delivering vaccine as quickly and equitably as possible in our community, just to reinforce again the need to strict adherence to public health guidance and precautions at all time, and to echo Gibbie's gratitude for the community in abiding by this. Thank you.
First question today is Vanessa Ruffes, WCNC.
Thank you for taking my question, and I hope all of you are staying well. I wanted to follow up on something that I heard Dr. Mandy Cohen say yesterday. Yesterday, she said that there were multiple cases of the UK variant that we have confirmed in North Carolina. So I wanted to see if there were any additional cases of the variant confirmed in Mecklenburg County other than the first case that we learned about over the
We do not have confirmation of additional cases in Mecklenburg County, but where there's one, there's going to be more. So I think we assume that we have that variant in our community now. We are not testing specifically for it. But the assumption is that we do have that variant along with the original strain in our community.
Next question is Ryan Pitkin.
Yes, thank you. I just wanted to ask quickly about, there has been talk in your weekly briefings, in your press releases, continuously about some of the disparate or disproportionate impacts on the Latino and Black communities. I believe it's something around 3 out of every 4 deaths that didn't happen in long-term care facilities were in these communities. And there was talk at the beginning last year about community outreach efforts in those communities. And I was wondering if there's any updates on whether it be related to the vaccine or testing or just community outreach and misinformation campaign or information campaigns. Any updates on community outreach in those communities in light of a recent report from a local organization that sort of highlights those sort of disparate impacts?
Yes, as we're planning with the vaccine, there's several different levels of effort that are going on right now. One has to do with information. We've been working with our public information office here with the county, as well as through our joint information center with emergency management that includes both hospital systems to make sure that we're communicating and getting information specifically out to those communities in ways that they can receive it. And we're using leaders in those communities as well. We're working with them to help us get those messages out as they are trusted in those communities. In addition to that, a number of efforts are happening at both hospital systems as well as through the health department to make sure that we're offering clinics in those communities and with the specific populations that we're talking about. As Dr. Sullivan mentioned, we'll be working with the refugee community next weekend on a clinic. We had several clinics this past weekend. Both hospital systems are providing clinics among our African American and Latino population as well. So we'll continue to focus on that. That is also a significant focus at the state level. And so we're all working on it together at this point in time.
Next question.
Thank you.
Next question is Alex Shabad, WCNC.
Hello, thanks for taking my question. Director Harris, I just wanted to get your reaction about this news that there's actually an extra dose per vial in the Pfizer vaccine, which is different than what the label says. Based on county data, it looks like the county is able to capture that extra dose about 86% of the time. Are there challenges with capturing that extra dose, and are you satisfied with that number?
I believe we've been very successful in getting the extra dose out of the vial when it's available. Obviously, the vials came with an expectation that there's 5 doses in the vial, but from the beginning, we've recognized the ability to get an additional dose out, and our staff have been very effective in doing that, and we'll continue to do that as we move forward.
And just one quick follow-up question, if I might. The FDA is recommending providers purchase a special syringe, a low dead volume syringe. Is the county interested in purchasing one of those?
We've been utilizing the equipment, the syringes that the federal government has been sending with the vaccine, and at this point, that has seemed to be effective for us. We don't have any particular plans at this point to spend additional dollars on those syringes.
Thank you. Appreciate it.
Next question is Elsa Gillis, WSOC-TV.
Hi, all. Thank you for doing this. Quickly wanted to clarify the health department's position on students being in school. Does this modified directive support a decision to return students back to the classroom? And then do you have an update on when school staff could get the vaccine? Thank you.
You're welcome. We do support, especially based on the research that's been done, the study that came through the CDC, as well as what we see with the data here. And as our numbers are dropping, we're supportive of the children going back into school, especially our younger age children. We think that needs to be the focus and the target to begin with. So we are supportive of that, and we'll continue to work with our school system as they move through that process.
Next question is Allison Kuznets, Charlotte Observer.
It's Allison from the Observer. This might be a split question for Gibbie and Dr. Sullivan. Could you talk a little more about the outbreak at Roof Above? For the cases that you listed, can you clarify how many hospitalizations there are and what vaccinations look like at the shelter? Are people being vaccinated before they're able to enter the shelter? What do the protocols look like, and how many vaccines have been administered to date?
As far as I know, there may be one individual who's been hospitalized from that outbreak. We have worked with the shelters to offer vaccine to individuals in the shelter 65 and over to be consistent with the recommendations from the state for groups 1 and 2. There's no requirement for people to be vaccinated before they enter a shelter, and at this point, there's not sufficient vaccine to do that. Most of those folks will fall into group 4. And I'm not sure exactly how many we vaccinated. Dr. Sullivan, do you have more information?
So I don't have the exact number, and particularly for that facility, but it has, again, we've worked for individuals in group 1. So that includes some of our healthcare workers that work in the shelter setting, such as our nurses, and then any individual over the age of 65. So it has not been an overwhelmingly large number, but we have done outreach and will continue to do so.
Next question is Tony Mecia, Charlotte Ledger.
Thank you. Thanks for taking my question, and I appreciate how often you all do these. I think it's very helpful. Do the county and its hospital partners have any modeling that shows what's expected to happen regarding hospitalizations in the next few weeks?
The hospitals do modeling around what their expectations are, what they expect to see based on what's going on in our community. And unfortunately, that modeling at this point in time doesn't really include input from the fact that we now have the variants in our community. So we're continuing to watch all of that carefully, but they do that within their walls, specifically looking at what they might expect in terms of bed needs, making sure that they're appropriately staffed.
Do you know what those show?
We see that on a somewhat regular basis. What we were expecting is to see their numbers start coming down at least by the second week in February. And as you can see, that's already started to happen. So we're hoping, again, that it continues to move in that direction. They thought they would peak early in February, but I think without additional numbers, we've already seen a peak. Hopefully it will continue to stay down and move down.
Well, thanks. And then one quick follow-up, if I might. Just my question's on metrics from the last couple of weeks. Since you put out the directive a couple of weeks ago, we have some metrics now, both in terms of social distancing, the county always puts out, that seems to be fairly flat, and then all the traditional metrics, the COVID metrics, which have largely fallen. Do you have any thoughts on how effective your directive has been?
That's a great question. I'm hoping that the directive was somewhat responsible for the decrease in the numbers, that people are actually listening and doing what we know is going to be effective in getting our numbers down and keeping them down. But in addition to that, we do know that some of the decrease was related to the time out from the holiday season, when we did see increases in our numbers based on the activity that occurred over the holidays. So it's probably a combination of things. It's never one thing that's going to make the difference. And hopefully the directive did have some supportive impact on the decrease in numbers.
Thank you.
Next question is Brett Jensen, WBT Radio.
Hi, guys. Thanks for doing this as always. Gibbie, real quick, in terms of the recreational sports for the youth, and whether it's youth basketball or youth soccer or whatever, why wouldn't you allow that to participate, even though they're going to be starting football practice, basketball, everything else at the high school level? So if it's good enough for high school, why is it not maybe good enough for the 10-year-olds?
In my conversations with the school system, I asked them to focus on in-class instruction. We do know that those sports are high risk for exposure. We also know that many of the clusters that we've seen in our schools, both in our private schools as well as our public school, have been related to sports. And so my recommendation to the schools was that they should delay the start of those sports. As always, the school system and the Board of Education makes those decisions. So I have concerns about those sports starting back up, as well as continue to recommend the recreational sports do not occur as well.
And I've got one more follow-up concerning schools, a question that was asked earlier in terms of teachers and getting vaccinated. I know, Ernest Winston, we just finished speaking with him not long ago, and he said again that he reiterated that they're trying to make sure that teachers are, for lack of a better term, at the forefront in getting this vaccine sooner, but hasn't gone into detail in terms of who. So do you think that a 25-year-old second grade teacher should be ahead of someone who's in their 60s, 63, 64, just because they're a teacher? Or what's your stance on the whole teacher vaccination thing?
Well, we know that the teachers are part of Group 3. Actually, it's teachers as well as support staff in the schools are considered part of Group 3. And as Dr. Sullivan mentioned, we are working on developing the plan for implementation of Group 3. I will tell you there's any number of groups in Group 3 who want to be prioritized and at the forefront. Teachers are one, law enforcement's another, and the list goes on. So we are working to figure out how best we can get that vaccine out when the decision is made to open up group 3.
Awesome. Thanks, Gibbie.
Mm-hmm.
Next question is Ashley Daley, WCNC.
Hi, everyone. Hi, Gibbie. My question is for you as well. In working so closely with the school district, you obviously just gave your opinion on, based on the data, that it's safe for CMS to return. My question is, for those younger grades, the K through 5, when they do return on February 15th, it's going to be on the rotational basis again. Would you have any recommendations against returning those younger students to a 5-day model, given what we know now and the data?
In my conversations with the school system, they had their plan mapped out as how they would open things back up when they did after the holidays. And I think we continue to support that plan. It makes sense to move slowly into that. I think one of the challenges that we see sometimes when we open things up since this pandemic is that we have a tendency to want to open it up all at once. And then the next thing we know, we have lots of cases. So I'm supportive of moving slowly and getting the system in place and getting the children settled in and seeing how that goes before we go to a 5-day week with the students. Now that could happen fairly quickly, but right now, based on our numbers being still quite high, I'm supportive of the phased approach.
Next question is David Hodges, WBTV.
Thanks for your time. As always, I appreciate y'all being available. And I think this kind of goes to what you were just saying, Gibbie, but in spite of the research from the CDC, do you still harbor any concerns about schools being a source of positive cases if things aren't done the right way?
Well, I think, as I've stated, the plans are good. The school has what they need in place to make it a safe environment for the students and for the teachers. There are a couple of things that need to go along with that. Number one, plans have to be implemented with fidelity to be effective. So that's the first step. The second step is those folks who are coming in and out of the schools, teachers, children, and their parents are going to have to help with this as well. We know we've still got a lot of virus in our community, so they should limit their activity outside of the schools. They need to be staying at home when they're not in the school setting, as we've talked about with everybody else in our community. We need to limit our exposure, because if you limit your exposure, you're less likely to bring something into the schools. So again, there are a couple of things that need to happen for that to be as safe as it possibly can be, and hopefully that's what we'll see.
Okay, the floor is open for follow-up questions. Any further questions? Thank you, everyone.
Oh, can I ask a question?
Go ahead.
Okay, it's Allison from The Observer. I know you said you don't necessarily have the modeling yet for the variant, but when would you start to maybe expect, we definitely have one case, when would we start to expect that the trends would reflect that, and what would be your first indicator, especially now that we are adding CMS back into the mix and we're going to see more activity in the community of people gathering in schools?
Well, again, I don't think there's ever any one thing that contributes to our numbers going up or down. I think it's multiple things. We've got things opening up some more. We've got children going back to school. We will see some increases in activity on our university campuses over the month of February. Those things obviously introduce the potential for exposure in our community as well. And as folks start moving about more in our community as we move into the spring, that could help, that could hurt, just depending on the type of activity they're involved in. And then we introduce the variant into that. So I'm not sure that we can point to any one thing that could affect our numbers. But I want to just reemphasize the fact that we know what will help keep our numbers down, and that's what we need to stay focused on. People need to limit their exposure, and that means not being out unless they really need to be out, and wearing their masks and socially distancing. So we just continue to stay focused on that and watching our numbers closely and then having to adjust based on what we're seeing.
Gibbie, Brett Jensen again. Have you spoken to the hospitals, or have they indicated to you like how the ICU cases, the COVID cases in ICU, are 35 to 40% over the last couple of weeks, and what they think that means going forward?
Basically, what we're hearing from the hospitals right now is that they're seeing those numbers starting to slowly start to trend down as well. And everyone is watching it very closely. As I said, we don't know as we expect to see more of the variants in our community, what impact that'll have. So again, for all of us, it's just a matter of continuing to stay vigilant and watching the numbers, but also trying to protect our community as each of us needs to do on a regular basis.
It's Tony Mecia with the Ledger. With the presence of these new strains of the virus in the community, would that be a reason to not send kids back to school?
At this point, it's not. I don't believe. We've watched our numbers. We're seeing them coming down. We're hoping they're going to continue to stay down. And the plans are to move forward with bringing the children back into school in another week. Again, we'll work closely with the school system, but I think we need to move forward. Right now, as you've heard, the studies from the CDC, the things that we're seeing about our schools not being a huge cause of concern, we just need to make sure that we're implementing the things that need to be implemented to keep them safe so they can go to school.
Gibbie, Allison again from The Observer. From contact tracing, can you let us know for the person who we do know has a UK variant, did that person travel? How many close contacts? How many people are quarantining because of this case?
Well, that case actually happened very early in January. So, to be perfectly honest, that person was not terribly helpful with information. Actually, that individual refused to take our calls. So we were not able to gather the information that would have been helpful to know whether it was related to travel or not. So we don't have that information.
Any further questions? Thank you, everyone.